this is Rayanna R EXS, and I'll be talking to you about pacemakers and ICDs. What is a pacemaker and what is an ICD? So, a pacemaker is a device placed in your chest that is used to control abnormal heart rhythms electronically. It is used to either slow down your heart or speed your heart up. An ICD also works as a pacemaker, but it is also a defibrillator used to send electrical shocks to your heart when there is an abnormal heart rhythm. And ICDs can also be used to continuously record a person's heartbeat longer and is usually larger than a pacemaker. The role of a pacemaker and ICD are both somewhat similar. They both mimic functions of the SA node and create an impulse into the heart, as in ICDs also create the same functions, and they can also monitor a person's heart rhythm and overlook them as things are going. Arrhythmia patterns can vary, so this is the reason why a person would need a pacemaker or an ICD, depending on which one they have. That'll be their settings for their pacemaker or ICD. And so arrhythmias are known as irregular heartbeat that can cause a person to either have the pacemaker or ICD. And there's two types of arrhythmias, which is tachycardia and bradycardia. Tachycardia being a faster heartbeat and bradycardia being a slower heartbeat. And here's a picture to show you what is a normal heartbeat, slow and fast. And then you can also break those down into different types also. Some signs of a person needing a pacemaker or ICD is having the irregular heartbeat, such as tachycardia or bradycardia, over a long period of time, meaning it will be chronic. So that person will need something to help them for down the road. Also, history of cardiac arrest or a heart attack. All it takes is one time, and you may need one of these devices, or genetic heart condition that runs in your family. They might say after you get your testing done, they might say you need one. Symptoms of pacemakers or ICDs. Some symptoms you may have after receiving the pacemaker or ICD is swelling or bruising. There will be a scar towards your collarbone that you may have, shifting of the device. That's why it's very important to watch where you go, what you do, especially on the left side of your body. Palpitations, which you may feels like shortness of breath or fatigue, tiredness, or dehydration. It's very important to know signs and symptoms so that you can know what to do and when to fix those issues. Blood clots is also another symptom from getting the device. It can cause blood clots in your body after surgery, especially. And after you have surgery, the doctor usually will have you stay for two nights, 2 days, or whatever, and just monitor you, make sure that everything's okay. Another one is hematoma, which is like a scarring and blood. When after you scar, it could form a hematoma. And fatigue, you just feel tired and drowsiness. The diagnosis of a pacemaker ICD really determines on your specific symptoms and a specific patient. To decide if a person needs a pacemaker or ICD, they will first go through several tests, and some of these tests include EKG or ECG, which measures the heart rate and those electrical signals. An echocardiogram or echocardiography, which is an ultrasound of the heart, and lets you see an image of that heart, of the person's heart. You can see a little more deeper inside of what's really going on. And the last one being a Holter monitor, which is an external electrical device that records your ECG. And many of the times you can comes with like a clip. You can just wear it on your hip, and it has leads connected to your heart, like little sticky pads, so that can read different parts of your heart. And so those are how people the diagnosis is made after taking those several tests. Some of effects that pacemakers or ICDs have on exercise, although their exercise is safe to do, it is important to consult with your physician first and make sure that it's safe, because everyone is different, everyone has different side effects, everybody is at different levels. So performing in contact sports is probably not recommended, especially right after you have your surgery, due to that impact of the device. Like I said before, it can shift, it can move, it can cause a blood clot. So it's really important to not um, performing those type of sports and performing things such as running and cycling and just like things by yourself or not so much contact is smarter to do, especially just starting out. It's important to always monitor your heart and make sure that you're in a safe range of you're in a safe range to start exercising. You don't want to start out with vigorous intensity just right after your surgery. You want to start out low to moderate, and especially if you're already an active person, you will not be at the same level as you was before getting your pacemaker or ICD. So you want to start out as if you're just starting to exercise again, but after exercise testing you'll know where you are and you can go from there. But it's smart to start off with a low intensity. Another thing to be mindful of is that dehydration, which can occur during exercise. So, and that can also raise your blood pressure. So you want to keep and be mindful of that also, and drink fluids during, before, or after your exercise. Just always want to maintain that hydration after exercise and during it. Management and meds for those who have a pacemaker and or ICD. It's important to be mindful of other electrical devices such as security devices, phones, anything magnetic you want to stay away from. So if you're going to like the airport, you cannot walk through those scanners. You have to tell them like you have a pacemaker or you have an ICD because it's very sensitive to you, um, and it can make your device function the wrong way. Those who have ICD may also have the restriction of driving based on the individual and how what their diagnosis is, and they're also where you live, determining what country you live in. They might restrict you for driving for a certain amount of time, especially right after you get your surgery. They might not let you drive. Frequently monitor both of those devices and meet with your cardiologist as recommended. Like I said, everyone is different. Some may have to meet with their cardiologist every year, some may be 2 years, some may be 6 months. So make sure that you're keeping up on meeting with your doctor, and make sure that you're monitoring frequently and having those checkups and making sure that the doctor is on it too, and make sure like your battery, because there is an electrical device, so make sure everything's functioning properly. And about 70% of pacemakers that are implanted are in older adults over 65. For my case study, I have a lady who is 62 years old named Hannah, who just received a pacemaker due to recent cardiac arrest and past family history of cardiac arrest. Hannah was she was physically active before receiving her pacemaker and wants to continue to do so. Her goals are to walk around her neighborhood without being short of breath and to dance all night long during her son's wedding next spring. So for Hannah, the exercise testing I chose to do is a 6-minute walk test because it is very simple for her to be 65 years old. She just got this surgery, and her goals are pretty simple and they are doable. So the 6-minute walk test is very simple because it doesn't require any heavy lifting, but you don't want to do, especially right after you have surgery, especially on your left side or any of your arms. You don't want to do any upper body heavy lifting. So this type of exercise test is perfect for her, I believe, or anyone that just coming out of the surgery. And it also will allow to measure Hannah's general like physiological movements, and it allows her to walk at her own pace. in her own time, and take a breath when she needs it, take a rest when she needs it. So that's why I chose this exercise test. For the exercise prescription, before starting any exercise, Hannah consulted her physician and they recommended that she start to do only aerobic exercise. You can also do aerobic, strength training, flexibility, but due to her circumstance, her physician required her to do just aerobic exercise. And looking at back at her goals, that is something what she wants to focus on right now anyway. You the most important thing of before exercise prescription is making sure that the person has consulted with their physician. Like I said, everybody is different. Everyone is in different stages. So what might work for this person might not work for another person. So it's really important to consult with your doctor or physician or nurse or someone to make sure what intensity and where you should start and when you should start exercising. So the fit model for Hannah would be about 2 to 5 days a week or 3 to 5 days a week with an intensity of light to moderate. Although she was already physically active, they wanted her to start out with the light intensity because, like I said, you're starting out, you're just readjusting everything, so you want to start off light and moderate. For the time, you want to increase from 10 to 20 minutes when you're working your way up through the weeks to 20 to 60 minutes. It's a gradual increase. And this will be an aerobic continuous exercise. So she's going to keep on walking. You can take as many rests as you need to. She's just starting out. And that's that. For my conclusion, I just wanted to make sure that I explain well that although we might think that heart health is not something important now, it is, and what you do now will affect you later down the road. So I hope this information was very insightful and can help everyone understand a little bit more about pacemakers and ICDs, because it's something very close to me and my family, and I hope that you grasp the importance of heart health, especially as you get older, and realize that your physical, your mental health right now is very, very important, and if you work on it now, it will get better. So thank you.